Bismillah ar-Rahman ar-Rahim. First of all, I would like to thank Dr. Ahmed and Dr. Islam for the kind invitation to be here in the nice city. The vitrification, we use the slow freezing more than 28 years, 30 years, but the results was not like the new method of vitrification. That is why we shift 2004 from this slow freezing to the very quick freezing procedure. So the vitrification revolutionized the way how to treat the assisted reproduction technology. This debate was yesterday about multiple pregnancy, and I am so proud that Edwards, he got the Nobel Prize 15 years ago. He was my guest in our house in Lübeck. So this is the first baby born 1982 in Germany when I was 27 years old. And here immediately after the cesarean section. So the interest to do the freezing was increased dramatically in the last years. So worldwide, here stated 5 to 0.5 millions. I think now it is doubled children born through the assisted reproduction technology. And 20 to 25, I think also more of the children born through cryopreservation procedure, especially by the vitrification. Cryopreservation of human oocytes, zygotes, cleavage stage embryos, blastocysts, useful adjunct to human IVF and embryo transfer program. Vitrification, an ultra-rapid cooling technique, offers an interesting perspective in the attempts to develop the optimal cryopreservation procedure for all stages of human oocytes and embryos. Up to now, scientific results have proved that vitrification is the best than the slow freezing procedure. Just if there is interest to know about the slow freezing method and the vitrification method, here the vitrification, we take 90% of the intracellular water. In case of the slow freezing, it is not like the vitrification. Some of the intracellular water will stay inside and will make tiny crystals inside. That is why the survival rate by the slow freezing is about 40 to 60%, while with the vitrification we have 100% survival rate if we will do the method accurately. 1937 wrote that crystallization is incompatible with the living system and should be avoided whenever possible. Here we have this comparison between the crystal formation and the vitrification, like the glass formation, so there is a huge difference between the two methods. Physical definition of vitrification is solidification of a solution. Water is rapidly cooled and formed into a glassy formed vitrified state from the liquid phase at low temperature, not by ice crystallization, but by extreme elevation in viscosity during cooling. Successful vitrification requires minimum volume method, increased viscosity, high cryoprotectant concentration, high cooling rate, warming rate, special vehicle device carrier like the cryotop. At the beginning there was a lot of different carrier, but with the last few years the cryop method was the best method for the vitrification, and also the open system is better than the closed system. And the direct plunging in the liquid nitrogen. Here the comparison between the slow freezing takes 3-4 hours, while with the vitrification, just 1 second, we have the liquid nitrogen near the microscope, and just 1 second moving from the loading to the plunging in the liquid nitrogen. Here, just comparison between the slow freezing and the cryoprotectant concentration here 1.5 mole, while here 3.0 to 5.0 mole. The volume is less than 1 microliter. Contact between liquid nitrogen, yes. Cooling rate very high. Freezing is ultra rapid. Thawing is also rapid. And time consuming, as I said, few minutes. And from loading to the plunging is 1 second. Dehydration here is controlled by vitrification. Reduce osmotic injury, yes, in the vitrification. Zona pellucida fracture is not like in the slow freezing because of the tiny crystal formation. Ice crystal formation in vitrification there is not. Seeding, as you know from the slow freezing, we have to induce the crystal formation at -7, while here it is not necessary. Device, we don't need any device. Device is very expensive for the slow freezing, while here just the carrier. The cost is less. Liquid nitrogen amount using the planar machine, we need sometimes 60 to 100 liter of liquid nitrogen. Here we have just a few milliliter of liquid nitrogen. Here just example how to load the cryotop, just to put on the surface of the device, and we have to remove a little from the media. The risk of contamination, there was debate many years ago, and now it is not, nobody is asking about the open system and the closed system, because there is no, just experimentally they have done this risk of contamination, while in the practice is not. Because we have from 60 till now in the animals, in the human, there is no cross-contamination in the liquid nitrogen. Unfortunately, the open system and direct contact might be indispensable to achieve the required cooling and warming rate for every sensitive sample. So far, commercially available closed analog, like cryotips and the other, failed to demonstrate the same efficiency for a human oocyte. That is why the open system is better for the better survival rate if we use the open system of the carrier like the cryotop. Now just about the results here from Koyama about the oocytes, because they have very mild stimulation protocol from the beginning when 2005, 64 oocytes, and they have better survival rate and also pregnancy with the oocytes. Here they show that the oocyte after thawing or re-warming is similar to the fresh oocytes, and they can grow in the culture till blastocyst. In Italy, in Rome, they compared the vitrified and the non-vitrified or the fresh. They found there is no difference in the fertilization and also in the pregnancy rate. This is the group of Antinori. The embryo development of fresh versus vitrified metaphase 2 oocytes. This is a nice paper. They divided the same oocyte from the same patient, part of them for the vitrification and the other is for the fresh, and they didn't find any difference. Excellent quality embryos here, 52 and 51, so there is no difference in the same patient, in the same oocytes group. Embryo development of fresh versus vitrified metaphase 2 oocyte after ICSI, prospective randomized sibling oocytes. This from Renzi. Conclusion of this paper, their results indicate that oocyte vitrification procedure followed by ICSI is not inferior to fresh insemination procedure with regard to fertilization and embryo developmental rate. In Spain, as you know, they do a lot of oocyte donation, and they have the oocyte banking. Here, the first paper published from Cuba, 231, they found there is no difference in the survival rate after thawing, and the ongoing pregnancy was nearly 50%. They exceed their paper and their work, and they have done, as I mentioned, the cryobanking of the oocytes in Spain. Comparison between fresh and frozen thawed embryo transfer. In Germany, we have strict law, so we allow just the zygote to vitrify them, and here from our center when I was previously. So there is better pregnancy rate when we do the vitrification of the zygote, as you see here, 34% than the fresh embryo transfer, 24. So 10% was better than the fresh embryo transfer. From that time, we stopped to do the fresh embryo transfer and also to avoid the hyperstimulation syndrome. We have 59 patients, and we have 25% of live birth rates. For cell stage, here from Aflatonian, he has done the fresh and compared to the frozen, and they found that there is better pregnancy rate with the frozen embryo transfer, the 4-cell stage, than in the fresh embryo transfer. 8-cell stage, this is the paper from India. The same, they found the pregnancy rate is doubled with the 8-cell stage with vitrification than the fresh embryo transfer. With the blastocyst, and this is the huge number till now with the blastocyst, 6,484 from Koyama, and you see the pregnancy rate was nearly or more than 50%. Yeah, they do also the zygote compared with the 4-cell stage and the blastocyst, so there is no difference in all stages for the vitrification. Successful vitrification, high cooling rate, fast cooling period, low volume, high concentration of cryoprotectants. This will avoid the intracellular crystal formation. Why we do prefer the vitrification procedure? This is the message: no mechanical injury, less osmotic stress to the cell, no intracellular crystal formation, less labor in the laboratory daily work. If you have a busy center, if you will do the slow freezing, you need many hours, while in the same day you can do freezing vitrification of many patients at the same time. Simple protocol, useful for oocyte and blastocyst, no need for expensive devices. The current aspect, avoiding hyperstimulation syndrome. Now every center says we have zero hyperstimulation syndrome because we cancel the fresh embryo transfer and we freeze all the embryos and the zygote. Avoiding hyperstimulation syndrome, cancellation of fresh embryo transfer, vitrification of all zygotes result from other program, an option for cancer patient to vitrify the oocyte instead of ovarian tissue, an oocyte donation program, vitrification of the oocyte to postpone fertility, the social freezing, maintain viability of specimen during long-term storage. And this was asked many years ago to put the vitrification, the slow revolution of rapid freezing. Quality is evolution, vitrification as a revolution. This was guest from Belgium in my center at that time. To conclude my talk, easy to perform, low cost, future first choice, or currently the best choice. It was shown to be superior to slow freezing procedure, very high survival rate. It seems the cryotop method is the most efficient procedure. Revitrification is possible, and we have also many pregnancies. Ovarian cortex is now also possible. Thank you very much for your attention.